A few more questions on public health, Secretary of State. One of the areas that this committee has heard a lot about is about the value of the investment in early years and what the positive ramifications can be for all of our long-term health.
Yeah.
There's many areas that we can pick up on, but in particular we know that there are now 2,000 fewer health visitors in our country since 2015, and we're seeing a lack of start-of-life investment, particularly in antenatal support, in breastfeeding peer support. We know that hundreds of children's centres no longer exist, and I wonder what your reflections are on what could and should be done to ensure that we give every baby born into this country the best start in life.
Well, I think children's centres in particular are very, very important. It's not quite right what you said, because more people are going through children's centres than ever before. There has been consolidation in how they're structured, and sometimes that is interpreted as a reduction in the numbers, but that's not quite right. This is it's a very important area to get right, and I think if we think about early intervention as part of prevention, then early intervention at a young age is especially important.
And according to the Shaw Trust, there's up to 1,000 children's centres across our country whose doors are no longer open. And I know within Liverpool, while we've maintained all of our children's centres, the level of service provided in the community in terms of what you can access is massively diminished. And that is replicated right across the country. And that includes things like antenatal support. We can look to right across the country where particularly breastfeeding peer support, which we know is so important to encourage new mums across the country to give them the support they need to be able to breastfeed, which is not one of the easiest things. We've heard lots of evidence about how important that is. I can point to many services across the Northwest that no longer have that funding. So that's just one area. Again, so I'd ask you to reflect on the reality on the ground.
Well, there's two different things you said. The figure, I know the figure that you just mentioned, about 1,000.
From the Shaw Trust.
Yes. That is when two Sure Start centres become one organisation so that they can run more efficiently. That is counted as a reduction in the number, whether or not the service continues to be provided. So I just caution on the statistics.
There are no children's centres across our country whose doors have closed since 2010.
That's not what I said. I said to be cautious about those numbers.
Okay. But again, I just reflect on what I know has happened, not just in my own constituency in Liverpool, but right across the country, is the level of service and activities and things that were previously provided is no longer available because of the cuts to public health, which we've just discussed. 6% between now and 2020 is obviously going to have an impact on the availability of those services, which in turn results in less support for new mums, for their new babies, and from conception right through to 2, which we know has a very significant impact on the life chances and life outcomes and health outcomes of those children into adulthood.
Well, I think that this whole area is incredibly important to get right. So, for instance, there has been an overall increase in the number of nurses, for instance, but that has been focused on an increase on nurses in acute settings. And I think that this is part of the reason for driving the increase in funding that we've got towards community and primary care and the whole prevention agenda.